Dr. Jankhana Hakani. I am a psychiatrist. I practice at Mind Health Clinic Fort at Sethi Hospital, Chandni Road, and at Health Spring, Kafpare. Today, I am going to be speaking about schizophrenia. Schizophrenia is a very serious mental disorder. It is a mental illness. It is very common. So, what is schizophrenia? Schizophrenia is an illness of the thought process. It is an illness of perception. It is an illness of emotion, and it is an illness of behavior and affect. So, what are the symptoms of schizophrenia? Anybody who's suffering from schizophrenia, how does he or she know, or the relatives know that he is suffering from schizophrenia? So we can divide these symptoms into two categories. One is positive symptoms, the second is negative symptoms. So, what are the positive symptoms? Positive symptoms are hallucinations, delusions, emotional lability, and odd or bizarre behavior. What are hallucinations? Hallucinations means hearing or seeing or feeling things which are not present. They could be auditory, they could be visual, they could be gustatory, olfactory, and tactile, but the most common is auditory hallucination. Second is delusion. What are delusions? Delusions means a strong belief about something despite evidence to contrary. For example, let's take us the example of delusion of paranoia, in which the patient feels that people are conspiring against him or her, they are plotting against him or her, keeping a watch on him through satellites, through television, etc. And despite showing him or her that this is not true and showing him proof and evidence, they do not believe to be true. They do not believe to listen to us, and they continue to believe their delusion. So, what are the negative symptoms? Negative symptoms are lack of emotions or emotional lability, apathy, anhedonia, social withdrawal, and flattening of affect, means there are completely mask-like flat. The third thing which is affected is self-care and hygiene. The patient may be dressed inappropriately. For example, the patient may wear multiple layers of clothes even when it is hot and summer. There is poor self-care. The patient may not bathe, they may not comb his hair, poor grooming, and there is disheveled appearance. So these are the few symptoms of schizophrenia. Many times the patient gets irritable, angry, aggressive, and violent, for which we have to admit and treat on it after admission. So what are the causes of schizophrenia? Schizophrenia is not having only one cause, it has multiple causative factors. One is genetics, so you maybe have a genetic genes which causes you to have schizophrenia. You may have family history, maybe your parents, your sibling, or your aunt or uncle may be having. So when you have a family history of schizophrenia, there are more chances of you to develop schizophrenia in life if you are faced with some stresses. Third is psychosocial causes, means any psychological stress or social stress can predispose these individuals to get schizophrenia. Third is insidious onset, that is without any cause. Many times we don't know what is the cause, and the person may get schizophrenia. Now, what is the age of onset of schizophrenia? It generally occurs between 15 to 25 years of age in males and 25 to 35 years of age in females. It starts at a very young age, it's in the 20s. And male and female have they're equally affected. It is not like males are affected more than females, no. So what is the treatment? So once you know that these are the symptoms of schizophrenia, must not delay treatment, because studies have shown that the earlier you take the treatment, faster is the recovery and better percentage of improvement and more chances of staying without symptoms. It is a treatable condition. It is a manageable condition. You need to see a psychiatrist for that. The importance of taking medicines every day without fail as prescribed by the psychiatrist is very important. The medications are not habit forming, they are very safe, they do not have side effects. If at all the side effects do develop, they all are manageable, and we can also change from one medicine to the other medicine if you have side effects. Do not delay treatment from schizophrenia. If you have any more queries, I'll be happy to answer them. You can email me at mindhealthclinic@gmail.com. So this is all about schizophrenia. Thank you. Take care.